Um, Good day, the people of Instagram, Facebook, Twitter. I'm happy, my friends, to come today as well to present a very interesting topic. And this topic is about fibroids. I went through more literature to try to be able to help you out so that I can discuss the impact of fibroid in the management of fertile patient or infertility. Now, this will be evidence-based, and the whole approach has been, researched. Therefore, all the information which I'm going to give to you is going to be a very important information. Now, definition: what is really a fibroid, which most of us would like to know. But a fibroid, know that it's a benign tumor which is found in the uterus, and this benign tumor presents basically in about 3 ways. The first important thing, it can present with pain. The second one, it may be abnormal bleeding. And the third one, mostly it will be infertility. This condition affects mostly reproductive age group, and it affects almost 35 to 75% of patients in a reproductive group. Now, it's very important to really make a good selection of your treatment based on whether the patient wants pregnancy or not. And in that, you look at the size of the fibroids, where it's located, and as well, we have to look at the number of the fibroids. Now, fibroids and infertility. Now, in patients who are seeking to be pregnant, having a problem, we find out 5 to 10% of those patients actually have fibroids. Now, I want to explain mechanism. How do fibroids prevent women not to fall pregnant, or obstruct them or make pregnancy very difficult for this? This is about mechanism. Now, how do the fibroid do that? Firstly, the fibroid can obstruct the fallopian tube, and secondly, the fibroid make the gametes or the embryos have difficulty implantation in the endometrium, and thirdly, the fibroid can distract or distort the endometrial lining and make implantation or pregnancy very difficult. The last important thing, fibroid, we know now, can change the receptivity of the endometrium. Although there is lack of prospective and randomized controlled trial in this, but this we know, fine. Removing a fibroid increased the pregnancy rate by 20 to 42%. Now, I want us to discuss the effect of fibroid on ART, which is assisted reproductive technology. The relationship between fibroids and infertility has been elucidated in many studies, summarized in several meta-analysis studies, systemic review. And these have proven that really fibroid affect endometrial receptivity, fibroid affect implantation of the embryo, and in people with fibroid, there's a low pregnancy rate. Therefore, this is very important information which we should know. Then I want us to look briefly at fibroid with pregnancy, because other people will say, no, I have fibroid, but I got pregnant. It's very important to know that although you are pregnant, and some patient may be pregnant with a fibroid, but doesn't mean that the pregnancy will be uneventful. Therefore, fibroid in pregnancy has its own problem, which I will discuss with. By the way, if we look at the fibroid, the outcome of pregnancy with fibroid and the complication, which can be about 10 to 40%. Firstly, we have higher chance of miscarriage. We have very high chance of having a cesarean section as a mode of delivery, and we have got a higher chance of being premature labor, going to premature labor, and we have got also a very increased chance of malpresentation. And as well, we have a high chance of having what is called postpartum hemorrhage. Therefore, fibroid in pregnancy can really complicate pregnancy, and it will need those patients to be treated as high care patients. Now, let's look at the medical treatment which can be offered to patients who really have fibroids. Although I have to warn you that medical treatment is not indicated in patients who would like to fall pregnant. Therefore, medical treatment which I'm giving to you now is just for people who got, let's say, two things, pain and bleeding. For this, we can use progestins, OCP contraception, NSAIDs, and tranexamic acid, which will reduce the bleeding. The other medical treatment may be GnRH, mifepristone, SPRMs, which is uriprestat, SPRM1, which be isoprene, and letrozole. Those two reduce the size and probably can help you with bleeding as well. Now, surgical treatment of fibroid, which is the most important. In this field where surgical is involved and the patient got fibroid, as I said, it's fibroid management in a patient who are seeking to be pregnant. Therefore, it's very important that a surgeon who's taking, effort to operate you from a fibroid must be in mind, remember that you need to be pregnant after that. Therefore, a conservative surgery can be offered to you. Now, there are three methods. It can be laparoscopic, it can be laparotomy, it can be hysteroscopy. Now, I would like to stress that hysteroscopy, people usually will do what is called resection, which means that they resect the fibroid which is in the uterus. It's very important as well that procedure to be done very carefully, because that procedure can have a high complication. Therefore, resection of a fibroid can be done in a patient who's seeking pregnancy. Now, let's look at the pregnancy rate and obstetric outcome following myomectomy. Really, myomectomy increased the pregnancy rate by 50 to 60%. However, the risk associated with this is bleeding, long hospitalization, adhesions, and uterine rupture. But with technique of laparoscopy, most of those complications can be avoided. Therefore, patients stay for a shorter time in the hospital, less bleeding, and patient can go home with less pain. Effect of fibroid on an assisted reproductive technique outcome. There are two important facts which I would like you to know. The first one, the size of a fibroid is very important. Especially some people, they say, no, this fibroid, it's in the intramural, therefore it won't affect pregnancy. The answer is no. If the fibroid is more than 5 centimeters in the muscles of the uterus, it definitely will affect the outcome of pregnancy. It definitely will affect the outcome of IVF. Studies suggest that myomectomy before RT is likely to improve pregnancy outcome, and patients with submucosal, which you can remove by resection, and those with intramural, which is greater than 5 centimeters, need to be operated as well, preferably by laparoscopy. Now, there are two other methods which I would like, probably one, which is uterine artery embolization, which a lot of people go for it. Now, I would say uterine artery embolization is not recommended in women who are seeking to be pregnant. Why? The study have found that if you've done UAI or uterine artery embolization, the risk of malpresentation are very high. In other words, the baby becomes a breech or any other transverse line, or there's also a risk of preterm labor and high risk of cesarean section, and therefore also high risk of postpartum hemorrhage, and also you can end up with hysterectomy. Therefore, in short, I would say group or people from Facebook and whatever, this is actually more and recent information I'm giving you, and I'm happy for you guys to follow me. And follow me now. I'll give you more information on these topics and give you the impact on each and every topic, and try really to make sure that the topic or whatever I discussed, I make it very simple and use less medical terms so that you can understand exactly what I'm talking about, and you have a clue when you meet your gynecologist or your fertility specialist. Thank you for listening to me. Bye.